All right, very good. Thank you. So as Jana Verma said, the topic that I have been assigned is to talk about telenutrition. Uh, and of course, as again, Jana Verma said, this is a topic with which we have become very rapidly familiar, perhaps unintentionally because the pandemic forced us to. But maybe I can take a step back and just start with the taxonomy or the different words that have been used in the context of tele and various aspects of medical practice. So the broad term is telehealth, and telehealth includes teleeducation, telemedicine, and it also has a component of patient portal. And telemedicine, which is just one subset of various elements of telehealth, includes interactive patient care, remote patient monitoring, and what is called a store and forward system. And store and forward is something like an email or store an image and forward it. We can do it also through WhatsApp and many other ways in which we do it. So that's part of telemedicine. We all know, again, COVID-19, that we can monitor our patients remotely at home, and we have advised our patients with kidney disease not to come to hospitals, but to use these simple tools like a thermometer, a glucometer in the case of someone with diabetes, a blood pressure instrument, and a pulse oximeter, and use their cell phone as the central communication device to stay in touch with their healthcare providers. So if we again step back and look into this overall framework of telehealth and telemedicine, so health is the or telehealth is the big umbrella term that we have here, right? And the telehealth includes everything: curative medicine, but preventive medicine, promotive medicine as well. And then within that bubble of telehealth lies telemedicine. Telemedicine is more curative. And then you have, in the end, you have medicine, clinical medicine, which we usually practice face-to-face. And if you look at telenutrition, it encompasses this, or rather straddles across the telemedicine and telehealth bubbles. And we'll go into details, and I don't want you to get intimidated by this framework, but then we can also look at the taxonomy in other ways as to what is the application type, what is the population, what is the provision, what are the intended outcomes, etc. And you can look at it, you have several factors to consider. And again, this is just to give you an indication of where this field is moving, rather than to necessarily look at it and remember everything in the form of question-answer sessions. So we all know that there has been a massive growth in telehealth approaches during the COVID-19 pandemic. And this is data from United States, which shows growth in telehealth usage during the COVID-19 pandemic. We all know that the pandemic started sometime in late February, early March in US, and then telehealth use rapidly increased in the one to 1.5 months, and then it came down somewhat as the pandemic started to recede, but it has remained reasonably high compared to the baseline. The use of telehealth is still almost 40 times more than we had it before the pandemic hit us. But there is a substantial variation in the share of telehealth usage across the various specialties. Again, in US, they ascertain how much telehealth is being used based on the claims or the reimbursement claims that come for it. And here you can see nephrology somewhere here in the bottom in the middle panel, and you can see that the use of telehealth in nephrology is not as much as it is in some specialties like psychiatry, endocrinology, rheumatology, gastroenterology, etc. So then, coming to the topic of this afternoon, which is telenutrition. So how is telenutrition defined? So it has been defined by official organizations as, and I've highlighted some of the points that I wanted to really emphasize, which is that it is an interactive use. So it is not unidimensional or information flow from one side to the other, but it is an interactive use by, of course, a registered dietitian or nutritionist of course, electronic information and telecommunications or technologies, which helps in nutritional assessment, nutritional diagnosis, and development of a nutritional intervention, as well as a plan of care, followed by monitoring and evaluation with patients or clients being at a remote location. I think this is something which we all understand, but these are a few important points that I wanted to highlight. There are a number of domains of telenutrition, which could range from education, counseling to development of a care plan, assessment and screening of a patient for nutrition, recommendations for specific supplementation. We had some words about protein supplementation in the previous talk, but there could be other supplementations required. If a patient is admitted in hospital, a nutritionist can, through telehealth approaches, help with discharge planning. And once the patient is discharged, follow up and monitoring of this patient's nutritional status using telemedicine tools. And what are these tools? These tools can be multiple, and we all have used them. You can use just a simple phone call, or a one-to-one video consultation can be done. You can also have group calls. I think this is something useful in the context of telenutrition, and I would like to highlight it, is that one nutritionist can actually interact with several patients at the same time through these group calls. We all send emails, but we can also use other devices, which then through a phone, which is Bluetooth enable or something, can act as a funnel which sends the message or sends the information to healthcare provider. And many of these devices are now being developed, and hopefully many of them will come in the field of telenutrition as well. For example, I can think of bioimpedance devices which can talk using Bluetooth to through an interface and send information about nutritional status, body composition to a nutritionist on the other hand. And not to forget WhatsApp, which you use all the time, but WhatsApp is also notorious for its misuse because you can spread a lot of misinformation through WhatsApp, so we need to be careful about that. So how do we conduct nutritional assessment using tele approaches? So there are a number of tools of assessment which can actually be implemented through telehealth approaches, which include subjective global assessment, calculation of the malnutrition information score. Even frailty assessment can be done using the Fried Frailty Index through telemedicine approaches. The physical examination is difficult, but at least a visual inspection of fat and muscle loss can be made by a nutritionist if the same nutritionist has been serially following up a given patient. We can also assess the diet and food intake, and this can be done through dietary record, which of course can be shared either through WhatsApp or over a phone call or over a Zoom call. And once a dietary record is with the nutritionist, then they can conduct a supplementary interview to fill in the missing information. During that interview, a 24-hour dietary recall can be implemented. And of course, you have the food frequency questionnaire, which can also be implemented using remote methodology, or even filled through an online form and so on. What are the advantages of telenutrition? It, of course, gives you a longer assessment time because you are not bound by the time the patient is available in the clinic. Telenutrition also allows us to assess family situation and interact with caregivers. You can imagine that if a patient is sitting at home, the patient has his or her family around it. And as a nutritionist, you can interact with the whole family and find out if a patient is not able to give appropriate information, whether the patient is eating all right, what kind of food is the patient eating, are there any other challenges. Often caregivers have much more information and much richer information to give than the patient himself or herself. We can also, using these video calls, ascertain home environment. We can see if there are any constraints in the patient's ability to acquire appropriate nutrition. For example, the home may be crowded. If required, you can, if the patient possesses a fridge, which most of the patients will, you can actually assess the fridge also. You can ask the patient to open the fridge and show through these video calls by taking their phone to the fridge what are the various types of food they have in the fridge. You can assess their kitchen and make a decision on what can be done. You can, as I said before, of course, do group sessions. And just like you can have multiple people on the other side of the phone where the patient is, you can also have multiple people on your side of the phone and actually provide multidisciplinary care by either having a multidisciplinary team in the same place or linking in multiple disciplines using the virtual approaches. Then There are a few challenges that we should also be mindful about. There are large parts of India and many other parts of the world where the access to technology is relatively poor, and people may not possess all the tools, for example, smartphones, etc., that are needed for optimal use of telenutrition. There can be connectivity issues. All of us, despite being in very, very well-connected positions, have had dropped calls and Zoom meetings that get interrupted and so on. Some people have limited communication skills, and so they may find it challenging to engage in full benefit from the telenutrition sessions. Digital literacy is poor. Many people don't know how to use it. There is, of course, the question of provider workload, because as a nutritionist, one nutritionist, suddenly you have to take care of a number of people at the same time, and your workload increases. And last but not the least is the issue of billing. In many situations, of course, every provider needs to be paid for what they're doing. So whether it is the individual who pays, the patient who pays, or the system who pays, how does the telenutrition session get billed is also a challenge, because patient will often expect you to respond on a phone call, and you may not necessarily be paid for it. There are a number of factors which improve uptake and satisfaction of telemedicine use, telehealth use, and telenutrition use also, because it can promote learning and troubleshooting for new applications. We should encourage video consultations always. I think keeping the video off is not a good strategy for establishing rapport with the patient and their family members. We need to, if we train the providers appropriately, that can improve satisfaction both for the provider and for the patient. When we are planning a telehealth session, we should also always allow for some buffer timing, because connecting can take sometimes unexpected challenges and consume some time. And there can be follow-up questions. And if we don't have buffer timing, then we might end up hurrying the session. We should schedule training calls if required, especially for people who are not so literate in use of technology. There is a good value in doing some pre-screening on using some information that you might have collected offline before the online session is planned. We should use aids, decision aids, which can help in communication. And of course, billing practices need to be transparent. The question would be, does telenutrition work? It has been shown to actually be effective in several domains. There is no good data in kidney health domain, but studies have shown improved weight loss outcomes in patients with cardiovascular disease, in obesity, improving diabetes management in ethnically diverse and even rural populations. And diet quality can be improved, and dietary adherence can be improved when compared to face-to-face dietary counseling. These studies are already available, but we need to do more work in the field of renal nutrition. So the question is, how is telenutrition perceived by nutritionists themselves? And there was a study which appeared just earlier, and they identified a number of positive perceptions. I will not go into the details of these perceptions here, and I draw your attention to the reference which is down there at the bottom left, and you can get into that reference. And or for those who are interested, send me an email. I'll give my email address in the chat box, and I'm very happy to provide you with this information. But there are a number of areas of improvement also that were identified. And what were the solutions that can be actually implemented to improve the positive perceptions even more? So I think there are a number of things that we can do and that we can learn from. Especially the nutritionists appreciated the opportunity to look into the patient's home condition. They realized that the patients are more likely to keep appointments if it was a tele appointment, and the staff members were able to continue seeing their full caseload of outpatients during even the pandemic quarantine. But this is something which also allows us to get to things that we haven't done before, which is the aspect of personalized telenutrition. This telehealth approach also has an opportunity that will allow us to tailor the approach to the individual, their personality, as well as their goals from the life that they have. So as a nutritionist, how can you set yourself up for telenutrition? So there are a few things that you can do. You can establish your online presence, which is by creating a profile in social media and converting your face-to-face clients into digital clients by informing them, like I said, developing a social media profile and improving your credibility. You also need to prepare by setting yourself up in terms of your surrounding, and your clinic should look pleasant. To connect remotely, you should not be sitting in a place where your face is not properly visible. You need to have appropriate tools by technology, ergonomics, have a good chair, invest in a good video equipment, and of course, establish an online secure payment platform. And while you're connecting, you should use the medium of choice. It could be video link, audio, etc. And make sure that you check your video link, you greet your patient appropriately, and establish the purpose or the reason of consultation. And in terms of follow-up, we all should need to learn to listen more to the patients, which is called active listening. We should respond by empathy, and we should provide a constructive treatment plan which can be followed up over time. And the question that the General Verma asked, how do we use telenutrition beyond the pandemic also? So this provides us with an opportunity to find the right mix between the inpatient consults that we have, which can be used for screening assessment, because tele approach is not so good at it. And this allows us to make a diagnosis and plan the intervention, and then follow it up with telenutrition approaches for ongoing patient monitoring, patient and family education, group visits, and nutrition-focused quality improvement programs. So coming towards the end of my talk, there are some goods and there are some bads of telenutrition, and they are all shown here. These are points which I have mentioned before, but here they are given for the sake of summarization. And also to mention, there are a number of opportunities for innovation in education, in training of personnel, in home assessment. We should form a checklist for home assessment. We should make sure that we have appropriate allied care by combining nutrition with physical therapy and also medical care, which makes it multidisciplinary care. I would recommend use of checklists as much as possible and prepare for the visit. Don't go to a telenutrition session without preparing for it, just like we prepare for giving a talk. So, my dear friends, this is the last slide. You will wonder, what did I say? So the summary is that virtual consultation in the nutrition practice is feasible and should be encouraged. There is right now relatively little data in the renal space on acceptability, best practice, and outcome of telenutrition, but we have enough indication from other practices, other specialties that we can implement and incorporate in our practice. We should develop context-specific solutions to overcome barriers and identify the best path forward, recognizing the culture of the patient, recognizing the educational level of the patient, and recognizing the home situation of the patient. By exploring their preferences and their options for improving telenutrition experience, and we should work with them rather than impose our own viewpoints on what the patient should eat and what the patient should not eat. It's really very important to be interactive here, which I said right in the beginning as the definition of telenutrition. And in the end, we should also determine the optimal application and means for integrating with in-person visits, especially as the pandemic comes to an end.